Namaste. I am Dr. P Sharma. I am a senior consultant in medicine and geriatric medicine in particular. I am here at Jaipur to attend APICON 2022, a wonderful congregation where people are getting themselves updated in the newer scientific fields. Excellent conference. The topic on which I have been invited to speak is relevance of respiratory vaccines in elderly population during COVID pandemic. Friends, smoking, environment, COPD, all kinds of things, they expose the human beings' lungs, starting from nose to pharynx, windpipe, lungs, and then going to other parts of the body via the lymphatic channels or by blood are the infections due to bacteria as well as virus. During COVID period, we saw lot of role of vaccination, lot of role of prevention, and these things have been of great help to us. On behalf of Geriatric Society of India, way back in 2008, we were the first to come out with Indian guidelines for vaccination in older persons. And as our Prime Minister is saying that India is taking a lead, we took a lead and our guidelines are being followed in neighboring countries like Pakistan, Bangladesh, New Zealand, Australia for their geriatric population. What we advocate is use of pneumococcal vaccine, use of influenza vaccine, use of DPT, use of COVID vaccine also, which is now being promoted throughout the world and has shown its relevance. Because of the respiratory vaccines, we make the respiratory mucosa healthy. We make it less susceptible to infections, whether it is of bacterial origin or of viral origin. We have been promoting vaccination from the age of 50 and also in all those people who are prone to get infections or whose immune system is low, like people suffering from diabetes mellitus type 2, heart failure, chronic kidney disease, chronic liver disease, people on immunomodulators, people on steroids, people having cancers, people having osteoarthritis, low mobility, or those people who are mostly staying indoors in whom upper respiratory infections are very common. A stitch in time saves 9. Prevention is always better than cure. These are the age-old sayings which have proved their worth. Friends, I would suggest to all your patients who are in elderly segment, who are in the segment who have more comorbid conditions, who are in the segment where the body system fighting power is less, that means they have any kind of immune deficiency, improve their efficiency, improve their immunity, improve their fighting power of the body against invaders like bacteria and virus, and advise them to take vaccinations on regular basis. Thank you very much.